right now on Fox 5 News at 10.
The NYPD making changes to the way officers respond to calls involving people in a mental health crisis.
The new procedures are supposed to prevent deadly encounters with cops. Teresa Priolo has more on what policy changes entail.
We haven't done anything like this before.
The city of New York is attempting to change the way we think about and respond to the mentally ill. A Herculean effort launched with a task force in conjunction with Thrive NYC.
Mental health is as important as your physical health. I think that's a conversation that we're having now in New York and nationally.
Susan Herman is the director of Thrive NYC, a mental health initiative launched by First Lady Shirley McRae. Part of that conversation involves changing what we call these people and who helps them when they're in a crisis. There's talk the term EDP, emotionally disturbed persons, will fall by the wayside. Now the term will be mental health calls.
In other words, that EDP term is a way to marginalize people living with mental health concerns.
Each year, 200,000 mental health calls are made to 911. The hope is to encourage these people to only call 911 if there's a true emergency and reduce the dependency on law enforcement.
We want the police out of these situations as much as possible.
Another big piece of the puzzle? Co-response teams, a cop with mental health advocates responding together.
What we're trying to do with this is not only respond to people in that moment, but intervene earlier.
The city will invest $37 million annually towards seeing this through.
No one's saying this will solve every problem, but it's going to be a very substantial beginning.
In order for this to work, certain city agencies like the NYPD, the FDNY, and the City Health Department have to hire and train people for these co-response teams. We're hearing that could happen as soon as this spring, but nobody's committing to a hard deadline. Reporting in Lower Manhattan, Teresa Priolo, Fox 5 News.